Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Today we continue our ECG course, and today presentation on how to read a rhythm strip. My name is Ahmed Al-Hadidi. I am emergency medicine consultant. ECG rhythm strip, usually we take it from lead 2, and we can record it either in 12 lead ECG. It will be shown a long strip for lead 2, or by even 3 lead monitor. It can show lead 1 or lead 2 or lead 3, and best one is lead 2. How to read a rhythm strip? We use what we call 6 steps approach to read ECG. 6 steps approach, 6 questions. When you answer these 6 questions, you will have the ECG rhythm. First question, is there any electrical activity or no? Second one, is the QRS rhythm regular or irregular? Third one, what is the ventricular or QRS rate? Fourth one, is the QRS with normal, which is narrow, or prolonged? Is the fifth one, is the atrial activity present? And if there is atrial activity, is it B wave or other activity like atrial flutter or fibrillation waves? Last question, how is the atrial activity related to ventricular activity? Let's start with question 1. Is there any electrical activity or no? If there is no electrical activity, this means asystole. So asystole means absent QRS or absent ventricular activity. Usually it's wavy line. Sometimes there is B waves, and when there is B waves, it's called B wave asystole, and it's the same treatment and same management as asystole. It's rarely a flat straight line. Usually this flat straight line means lead disconnected. Some other form of atrial activity is fibrillation, ventricular fibrillation, which is disorganized or bizarre shaped electrical activity. This is in ventricular fibrillation, and it is activity of cardiac arrest. Second question is the QRS rhythm regular or irregular? And to determine it's regular or irregular, we compare the intervals between R waves. So between R waves, we compare it. If it's the same interval, so it's regular rhythm. If it's totally irregular and irregularity, this is atrial fibrillation. Sometimes if the rhythm is irregular and the rate is very fast, it's difficult to tell it's regular or irregular. Even sometimes it's faster than this rate. Third question, what is the ventricular QRS rate? And we know that normal heart rate is 60 to 100 beat per minute, and bradycardia if less than 60 beat per minute, and tachycardia if more than 100 beat per minute. This is for adult patients. We calculate the heart rate by dividing 300 over number of large squares between R waves. This is in one condition that standard paper speed is 25 millimeter per second. So to know the heart rate, we divide 300 over the number of large squares between R waves. So 300 over 2.5 equals 120 beat per minute. Here, 300 over 4 large squares equal 75 beat per minute. And here, 300 over 6 large squares equal 50 beat per minute. And here, 300 over 1 large square equals 300 beat per minute. If the QRS are irregular and the rhythm is irregular, like in atrial fibrillation, you cannot use the previous rule. So we have to count how many R waves in 30 large squares between these 2 points, 30. So we'll count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10 QRSs and multiply in 10. So count the number of QRSs in 30 large square and multiply in 10 equals 100 beat per minute, or even count in between 15 large square, 1, 2, 3, 4, 5, and multiply by 20, so it will be the same number, or even count in 10 large squares and multiply by 30, it will give you the number. But the most accurate is most accurate here is to count in 30 large squares and multiply by 10. Fourth question is QRS with normal or prolonged. Normal with QRS is less than 120 millisecond, which is 3 small squares. Less than 3 small squares is narrow or normal QRS. This means that the impulse or this QRS or ventricular depolarization originate from above the bifurcation of bundle of His. Also here, this is narrow complex tachycardia. Prolonged QRS is more than 120 milliseconds or more than 3 small squares. This means either the QRSs originate from the ventricle itself or from above the ventricle, supraventricular, but with apparent conduction or bundle branch block. So either it's ventricular arrhythmia like ventricular tachycardia or supraventricular with apparency in conduction or bundle branch block, either right or left bundle branch. Fifth question, is the atrial activity present or not? So is there any atrial activity like B waves, and best lead to see B wave is in lead 2 or lead V1? And if there is atrial activity, what is the rate, what is the regularity, and what is the morphology? You can see here, this is what we call P pulmonale. This is the morphology of P wave. For the rate, it is the same rate. So each P wave is followed by QRS. So it's almost 150 or 120 B wave per minute. Here, there is no atrial activity, but there is fibrillation waves in this rhythm strip. Here, there is no atrial activity. This is flutter waves. Also, this is flutter waves here. And if flutter waves like in this one is very fast and you cannot make sure this is flutter waves, you can give adenosine to the patient. It will slow the QRS activity and show the flutter waves, obviously, in the same patient. Sixth question, how is the atrial activity related to ventricular activity? So what is the relation between B wave and QRS? What is the relation between B wave and QRS? Like in this rhythm strip, you will see it's fixed and constant relation. Each B wave is followed by QRS, each B wave is followed by QRS, and BR interval, although it is prolonged BR interval, but it is fixed in all complexes and all beats. This is first degree heart block. Here also the relation between B wave is constant, but it's following each QRS. This is a junctional rhythm, so B wave following the QRS. P wave follow the QRS, and it's fixed relation. It follow every QRS. Variable relation like here, so B wave QRS, B wave not followed by QRS, B wave QRS, prolonged or progressive prolongation for PR interval until B wave not followed by QRS. This is second degree heart block Mobitz type 1. Here B wave no QRS, B wave QRS, B wave QRS, B wave, no QRS. So this is variable relation. Some B waves are not followed by QRSs, some B wave are followed by QRSs. This is also second degree heart block, Mobitz type 2. And sometimes there is no relation at all between B wave and QRSs. So B wave is fixed B to B interval and R wave fixed R to R interval. This is complete heart block. Thank you so much. And please don't forget to subscribe and like our channel.